Welcome to the Motherhood Alliance podcast, the podcast dedicated to empowering moms and families on their health and wellness journey. I'm Brittany Suttner.
And I'm Andrea Rankus. Together, we're here to explore holistic approaches that go beyond conventional medicine.
Each week, we dive into topics that matter most to you. Everything from nutrition and mental health to alternative therapies and natural living.
And whether you're a new mom navigating the early stages of parenthood or a seasoned pro looking for new ways to support your family's well-being, you're in the right place.
Even better, all of our guests are local small business owners who you can actually talk to and work with. You can learn more about today's guest and connect with hundreds of other health and wellness professionals through our informative and easy-to-use directory at motherhoodalliance.com.
Before we get started, keep in mind that this podcast is for informational and educational purposes only and is not a substitute for personal healthcare advice. Please consult your healthcare provider before making any changes based on the podcast content.
Thank you for joining us on this journey. Are you ready to help your family thrive? Let's get started. Hi, we are Britt and Drea from motherhoodalliance.com, and we are excited to welcome you to a 4-episode series with Dr. Chris Peterson, a well-known local dentist and the founder of the Wisconsin Tongue Tie Institute in De Pere, Wisconsin. Dr. Chris specializes in releasing tongue and lip ties for patients of all ages with a special focus on infants. His journey into this specialized field comes from personal experience, as his own daughter Audrey had a tongue tie, and as a dad, he had to navigate the challenges firsthand. Since having his own practice, which started in 2017, Dr. Chris and his team have and continue to make a significant impact by offering not only oral tie revisions, but also in-house support for lactation, myofunctional therapy, speech therapy, and more. Beyond his work, Dr. Chris enjoys spending time with his wife and 3 kids, hunting, fishing, and cheering on the Packers. We're excited to have him here to share his expertise and to answer a lot of your questions related to tongue ties, orthodontics, mouth breathing, lactation challenges, sleep apnea, and more. So without further ado, let's dive into today's conversation. Hello, welcome back, everyone. We are here in episode 3 with Dr. Chris. And so far, if you have not listened to our first 2 episodes with him, we have learned a ton. You've given us so much awesome insight. We've talked about really in-depth conversations about tongue ties as well, and tongue ties related to not just infants, but kids and adults as well. But then in episode 2, we really talked about lactation support and how that can play a role not only with tongue ties, but in other areas that families are struggling with. So that's what we've covered so far, but today we're going to be blending even more, going even deeper into this journey of oral health with myofunctional therapy. So Dr. Chris, I think the first question I have is, I think myofunctional therapy is becoming a little bit more known as a term, but what actually is it?
Yeah, great. First of all, that's good news. Myofunctional therapy, it's a mouthful, right? It's a tongue twister, but it is getting more well-known, and we're having more resources in the area. And we added a speech therapist who is trained now in myofunctional therapy, looking to add someone else. So if anybody's listening and wants a job, and you're really amazing at what you do, let me know. But no, this is a great way to help people because there's 4 goals of myofunctional therapy. Let's see if I can recite them off the cuff. You want to be nasal breathing. You want to have the tongue resting on the roof of the mouth and have proper tongue resting posture. You want to have your lips sealed, and you want to swallow properly. Look at that.
Look at that.
Addie would be proud of me, our therapist.
So how did you learn about myofunctional therapy? Is this something you learned about and were introduced to in dental school?
Absolutely not. Nope. There was 0 training on tongue ties, really. And myofunctional therapy, I had no idea what that was.
Which blows my mind.
Yeah, it blows my mind too.
Because
it's not surprising though, based on our experience too, even in the fitness industry as well. You get trained in a certain broad area, right? Which is great. But if you really want to learn about how to help people specifically, but with tongue ties and everything else, I feel like that is so important.
It's all about
dentistry.
continuing education. Absolutely. Yeah. You get a degree from a dental school, and then it's a license to change lives, if you want to. You can just do dentistry, or you can branch off and do a number of things: airway dentistry, functional dentistry, tongue tie stuff, myofunctional therapy in your office. That's all up to you.
But in the prior episode, you had mentioned that you really feel like if you were to throw a number out there, you would estimate that around 40% of people have an oral dysfunction.
Restricted tongue movement, I would say. Yep.
That's what it was.
Yep.
What about oral dysfunction? And when I say that, we're going to dive a little bit more into what I mean by that, but specifically like mouth breathing, I would even say can be caused by oral dysfunction, sleep apnea, snoring, these types of things. If you were to just throw a ballpark number out there on how many people struggle with some do not breathe properly, what percentage would you say?
Oh, it's got to be close to half or more.
Yeah. And that's why I think it blows my mind that it's not introduced a little bit more heavily. And maybe it's getting there within dental schools now today. But when everybody is going and getting checkups, ideally, like this is the opportunity to literally see these things and change their lives.
100%. Yeah, we as dentists have a golden opportunity to get ahead of a lot of problems, and just educating ourselves on that is key. And honestly, next month, I'll be speaking at the Brown Door Kewanee Dental Society meeting to a bunch of dentists and specialists in those counties, and just kind of saying, hey, as dentists, we have an opportunity to see these things, and a lot of them are going to know these things, but a lot of them are not. I guarantee you that. So that'll be a fun conversation, and just like, hey, we can change lives and help people breathe better, and not only move teeth and make them pretty, because that's important too, but airway.
Yeah.
Mm-hmm.
Yep.
Huge.
And we'll be diving really deep into airway in our next episode. But with myofunctional therapy specifically, how does someone know if they need it?
Yeah, so we call it an oral myofunctional disorder if there is something that you are doing inappropriately, whether that be breathing or tongue resting posture or swallowing inappropriately, tongue thrust habit, finger sucking. I mean, the list goes on and on. So if there are issues, then getting... And it's hard for the patient to know. I guess if you have something that I just said, then yeah, that's your pro tip is go get it checked out by an airway dentist or by a myofunctional therapist, and we got some in the area now, which is great. But yeah, that would be where I'd start is Google the term oral myofunctional disorders and see if anything is on the list.
If your symptoms are checking the box. I mean, basically, it's just like if you're not breathing well, if you're not sleeping well,
Yeah,
if
absolutely.
there's so many things that are common issues that people don't even realize could be tied to their mouth.
No pun intended, right? Tied.
I thought that too. Yeah.
Yeah, absolutely.
I think mouth breathing is something that's really prevalent, and that's something that we can obviously see.
Mm-hmm.
A lot of people mouth breathe, especially at night, and then they don't even know it. But can you explain a little bit about why nose breathing is better?
Yeah, absolutely. And then I want to touch on like what you can do about it, obviously, from infancy onward with your little one. But nasal breathing provides proper growth and development, first of all, because your jaws are in the right position and your lower jaw is going to grow forward instead of down. So if your mouth is open, your jaw grows down, and then you get a long, narrow face. So sometimes people walk in and I'm like, hey, you're probably tongue-tied, first of all, but you're mouth breathing, and I can see that. And if someone's mouth breathing during the day, you know that they're doing that at night. So you can spot these people. And now that you're listening to this, you're going to see these people all over the place.
Or
okay?
are you that person?
Exactly. But yeah, if we're breathing through our nose, we're growing properly, but we're also much healthier, and we're going to sleep deeper. We're healthier because all the things that are supposed to be filtered through our nasal passages are actually filtered and gotten rid of through the nasal passages and the sinuses and stuff like that. If it bypasses all that and goes right toward our tonsils, yeah, they're our first line of defense in our oral pharyngeal airway, but they're going to take the brunt of that, and then they're going to get enlarged. And then we see 3-4-year-olds that are snoring because their tonsils are huge, and we got to get the dang tonsils out, all because we're mouth breathing, because we got a dry mouth.
Oh, there's always something. It goes right to the very beginning, right?
Yeah.
Yeah. You have these cascades.
Yep. And so to speak on that, like we always tell parents, hey, a pro tip, when you got an infant, when they're sleeping, close their mouth, right? So you feed them, and then they're milk drunk, hopefully, and they want to sleep, and you close their mouth and get them breathing through their nose, because the more you do it, the easier it becomes, right? And then that tongue is going to be resting on the roof of the mouth and widening that palate, and therefore widening the nasal passages and making it easier to breathe through your nose. So you can start it right from the beginning.
You guys hear that? Pro tip, do that. So easy to do for a baby. Yeah.
So easy. If you wake up the baby, don't be mad at me, but try to do that.
Gentle. I get it. Yeah.
Then what about for older kids? So, they're not infants anymore. What can you do to help encourage nasal breathing for them?
Yeah, so that goes right into the talk about myofunctional therapy. And like we said, problems always become bigger and harder to fix as you get older. So if you got an infant, you fix the tongue tie, you breastfeed, you close their mouth, great. Hopefully you're setting them up for a lifetime of success and the right way of breathing when they're sleeping. You got a 5-year-old, 6-year-old that comes in and they got, like I said, a narrow palate because their tongue didn't do the job, and the tongue's on the floor of the mouth when the mouth is open. I mean, that's very obvious, right? If the mouth is open, the tongue is not up. It's possible, but it's definitely not there. It's down on the floor of the mouth, and therefore you got that narrow upper jaw, and then you got to get the kid to the orthodontist potentially to widen that palate. Okay, so my daughter's going through that right now, and by the way, she stopped mouth breathing within 1 month of getting a palatal expander and stopped wetting the bed. 1 month.
There you go.
Unbelievable. I became a believer very quickly, and she was 8, and I'm embarrassing her a little bit, but we talked about her enough. She's the one that got me started on this tongue tie journey anyway. But you can do the orthodontic therapy if you need to, right? Early orthodontic intervention. But if you have space for the tongue on the roof of the mouth, then we just got to train it to go up there. So if there's a tongue tie, then we got to fix that in conjunction with therapy. So we got to strengthen the tongue. We always talk about tongue tone, tongue space, like we talked about, strengthening the tongue, and then the space on the roof of the mouth. And then if there's a tongue tie, fix that. Those are the three things that we always look at in a kid's mouth and then work on each one of them individually.
What does myofunctional therapy actually look like? These are exercises, correct?
Yep.
Can you give us a couple of examples? Maybe something that our listeners could try with us, or even just I know we're not in video, but like trying to explain what some of these would look like, because they're fairly simple to do.
Mm-hmm.
It doesn't have to be an intimidating thing. It's when you think of therapy, it's like, oh, this, you think of a knee replacement. Oh, this could be painful and long. No, this isn't what we're talking about. So can you give us some examples?
One that I always thought was funny was when the therapist said, no, I'm not going to tell you the right way to do this, but I just want you to take your tongue, open your mouth a little bit, take your tongue, and then very gently lick your lips and make a circle all the way around all of your lips. And do that once. And then you realize how much you moved your lips to move toward your tongue, right? So then try it again without moving your lips, and curling your lips in, and just gently move your tongue. And your tongue should dissociate from your lower jaw, right? If it's tied, then obviously that's a structural issue. But if it's not tied, then you shouldn't compensate by moving your jaw with your tongue. So that's just one that's a little bit eye-opening, because everyone kind of curls their lower lip in when they lick their lower lip. And you shouldn't have to do that. It's a compensation.
Very interesting.
What about resting tongue posture? Where should your tongue be if you're not like talking or in conversation?
Yeah, so we always talk about the spot, like it's a magical place in a far-off land, but it's pretty much behind what's called the incisive papilla on your roof of your mouth. So if you take your tongue up on the roof of your mouth, you'll feel a little bit of a bulge, generally, right behind the front teeth. And right behind that spot is where you want the tip of your tongue resting all the time, okay, especially when you're sleeping. But you can practice that during the day, and being aware of that is a great thing. But then we want it not only in the tip of your tongue up there, but we want the entire body of the tongue resting on the roof of your mouth. And if you're an adult and you get your tongue up there, and you try to get your tongue up there and you can't, there might be a number of things going on. You might have no room, first of all, on the roof of your mouth, like me. I should have gone through more orthodontics early in life, and I'm just learning that now. But I have that narrow, long face. Not that you look at me, you guys, you can see that. But I don't have room on the roof of my mouth, so I am a mouth breather. So I'm mouth taping at night and doing all sorts of funny things to try to sleep better and be more healthy. But your tongue should be up on the roof of your mouth in that spot.
Okay. Yeah. And then how often are myofunctional therapy exercises done? So if somebody came and saw a myofunctional therapist, what does this actually look like for like applying into their life? How much work is this? Yeah,
great question. We ideally what we do is do a 12-session program, and it's every other week. That's what we're doing currently. Now that might change, as things develop here. But it's a 24 weeks, if you think about it that way, of a program. To accomplish those goals. So you're getting a list of exercises every week and practicing those with the therapist, and then going home and compliance is the biggest thing, right? Yeah. With any therapy, and any therapist out there is saying amen to that, because we can only do so much in that hour, but you got to practice those things. I believe it's about 3 times a day. So 5 minutes each. It's not the end of the world. You just, when you're driving home or when you're tucking your kids in, just do that with them. But yeah, it's not too rigorous, and you're not going to get too fatigued, but it is challenging, and you're strengthening your tongue. It's a workout for your tongue and your mouth and your jaws and all those things.
Mm-hmm. Mm-hmm. Yeah, and both of our kids have gone through myofunctional therapy, and we've definitely experienced the challenge of compliance with kids.
Oh yeah, and it's not like my youngest son, we're doing myofunctional right now, and it's not like he's not wanting to do it. It's just you have to remember to do it. Yeah. And if you have like if you're using a tongue depressor or something to move their tongue or to strengthen it or whatever else, like if you have tools, that's even like, okay, we can't do that on the way to school. So, you have to kind of really be flexible and strategic a little bit in your schedule. But, but once we do it, you can see that there's been changes. But again, it's just like working out. You got to just... Every little bit counts. Every
little bit counts. You got that right. And we always try to meet parents where they're at, and these patients where they're at. And by that, I mean, we're all busy, right? Kids, they got ridiculously crazier schedules than we do, even as adults. And we got to be realistic, so it's like, hey, if this isn't for you, if this isn't the time in your life, let's let's push the pause button here. But we're going to tell you what's ideal. And if you're on board, let's go.
Mm-hmm. And for adults, I mean, something that we do something I do for my kids is we all have these techie watches on our wrists, right? I have an alarm that goes off at the time that we're driving to school and from school. And so those are the times that we do it. And if you need to use a tool, like Drea was saying, because some mouth exercises, you might use a small tool to like help assist. I mean, just keep it in the car, maybe. But so now my kids kind of expect that when we're going to and from school, this is when we do it. And I try to make it a game. Like, okay, we're going to do this for 1 minute. And I don't know, just however you can make it fun. So whether you're an adult or a kid, using a little alarm on your watch has been really helpful for us. And then I'm not going to lie, like I'm not a perfect parent. We have kind of had to go the bribery way to make this happen in our house, where if they do their mouth exercises, I have them doing like nose spray to help keep their nose clear. The bedtime routine has become, they complain about the list, because when you actually are doing everything that I'm sure a dentist would like you to do, like flossing and mouthwash and brush your teeth and nasal spray and mouth exercises, like all of these things, you feel a little bit like, I know this list is big. So I've told my kids, okay, we're keeping a chart. If you do it 15 days in a row, I'm going to take you to Five Below and I'll get you something from Five Below. And so, it cost me $10 for my 2 kids, but it has been helpful in the compliance area. And if they miss, if they miss one day, we don't have a consequence for that. But if they miss 2 days, like if it starts to become an issue, then that is going to have to pivot. But I don't know. So just some thoughts.
Some pro tips there.
I don't know.
I know. I'm going to have to implement some of that.
We're all just in survival mode, just trying to figure it out.
Do what we got to do.
And we're definitely not. We had a huge gap where we didn't do any. Now we're kind of back on the train, and so we do the best we can as parents.
You got this.
Yeah. But okay, so one question I do have is, how do you know if you're doing the exercises correctly? And I think with your program, that is a great resource, because, you come in, they show you the mouth exercises. You guys have like videos by chance that like people can watch if they get confused on if they're doing it right. They're going to come back in 2 weeks, but what if they're kind of doing it wrong over those 2 weeks, or they kind of forget what they're supposed to be feeling? How do they know they're doing it correctly?
Yeah, that's a great question. Our therapist, I wish she was sitting here so she could answer that. She's in the room doing all the hard work, but I would say ask your therapist that. I know that I went through a program with therapy, and that's why I talk about compliance, and I'm realistic about it, because I was the worst patient possible, and I'm still mouth breathing, by the way. That's why I'm taping my mouth shut. But I would consult with your therapist, and just obviously we want to accomplish the goals, and I guess to speak on that, you get to the end of therapy, and every program's different. I can't say everybody's going to be 12 sessions. Some people are 8, some people are 4, some people are a little bit longer, a year long, because they're just they're that much more challenging, or they want to get certain things out. They want to sleep better, they want to breathe better, and following up with the therapist is the most important thing for accomplishing those goals and having that accountability, honestly.
Mm-hmm. And we've talked a lot about tongue ties, because, you are Wisconsin Tongue Tie Institute, right? Yep. So in our first couple episodes, we talked a lot about tongue ties. How does myofunctional therapy fit in with a tongue tie journey?
Great question. With myofunctional therapy, we talk a lot about, and right now, the age that we feel comfortable doing full-blown myofunctional therapy is about age 5, and it could be a 4-year-old if they're super compliant, but age 5, we feel really comfortable like doing all this whole program with. And under that age, Addie's great because she's a speech therapist and feeding therapist, and she'll evaluate and fix and help with those things at those ages. So that's why we have the full spectrum of help in our office. But when you have a tongue tie and you got a patient that's 5 or over, ideally we have therapy on board from day one, and then we're able to make the plan and get the child ready for the release. So we have a whole checklist of things that we want to make sure that the tongue is toned enough, that there's space on the roof of the mouth for the tongue tie release, and the child is comfortable with someone being in their mouth, honestly, so that when we come back and do the release, we can get a really full release. We can do a good job. We can make everything comfortable for the patient, and then following up after with the therapist. So we always say that the treatment is the therapy. 100%. And we don't always have to do a tongue tie release in the course of the therapy, but if we need a tongue tie release to facilitate the therapy and accomplish the goals, then we want to go that route for sure.
Do you guys support like devices? Like there's the Vivos, there's Myobrace, things like that. And we might be talking about that in the next episode as well, but just to kind of ask a little bit about that, because it does go hand in hand with myofunctional therapy. What do you guys support those kinds of devices?
Yeah, there's a ton of them out there.
Yeah.
Absolutely. And for adults, there's, like you said, the Vivos, and there's palatal expansion of in that regard. And I know orthodontists are cringing when they're listening to this because they don't think you can expand an adult. So it's a controversial thing, but I'm not a total expert on that. I like to lean into my orthodontist pals in the area. Apparently, you're in my pal now if you're listening to this, but I don't know why I said that word. But yeah, they're great, and they're really educated on these things, and so we have really good resources when it comes to that. So in our office, we don't hand out any devices other than the Myo Munchie. It's just a little mouth guard that kids chew on. My kids chew on it every night, bedtime routine, right? So my son thinks he's a Packer player, puts his helmet on, puts his mouth guard in, chews on it. And I don't care what it takes. Like you said, if there's bribery, get him to chew on that thing. It's going to strengthen the muscles of the face and get that palate widened and pre-orthodontic work that can be done. So when we got a 2 or 3 year old, that we got a really narrow, high palate or mouth breathing, that's something that we do educate the parents on and hand out in our office if we feel like it's appropriate. But other than that, we're not experts on the other things like Myo brace, tooth pillow. There's a lot of things that we want to learn about too. And it's out there, all that education. I got to cram that into my schedule somehow, but we'll get there. We'll get there.
Do you have any resources for families that are listening to this and are like, wow, this is really intriguing. I didn't realize that mouth breathing could be so impactful and lead to so many challenges even for adults. The resources, whether it's like books that you really like that people could order or anything else like that, websites?
Yeah, absolutely. My favorite book of all time is called Tongue Tied, surprise, surprise, by Dr. Richard Baxter. He's Alabama Tongue Tie Center. And I've interacted with him a little bit, and he's a super nice guy. And he's just trying to help, and he wrote, chapters in there from chiropractic perspective, speech therapy, pediatrician, dentist, all the things. And it's got all the latest research in there to support what we're doing. And it's a great read, really easy. And it's good for parents too, not only providers, but for parents. There's another good one called Breathe, Sleep, Thrive that is focused toward parents, and getting your kid to, if they're going to breathe, they're going to sleep and they're going to thrive, right? So it makes sense. But that's another really good, easy read. And it kind of connects all those dots that we're talking about.
Mm-hmm. And I would definitely say too, and we kind of talked about this too, the book Breathe by James Nestor is amazing. And I just told you, you got to read that because it was so good. And it was an easy read, really good storytelling and research in there too, to just talk about how breathing and airway and everything else is so important.
All right, let me order it on Amazon right now.
You do that
okay,
right
perfect,
now.
done.
Yeah.
So if somebody is listening to this and they're like, I'm identifying some problems, I just want to maybe have an eval done, where would they start with your office if they are thinking maybe this myofunctional therapy thing might be for them?
Yeah, so the way we set up appointments with Addie, or our therapist, and soon to be hopefully another one, so we can get people in sooner, because right now there's like 2 or 3 month wait. I mean, it's unbelievable.
That's hard, yeah.
Yeah, so we're really focused on that. It's like our goal number one is to get someone else so we can support this community a little bit more. But first step is calling the office, or messaging us on our website, but just saying, hey, I'm interested in an appointment, and then we're going to schedule a 60-minute appointment. It's going to be 30, 40, 50 minutes with our therapist, to evaluate for sleep disordered breathing, make sure that we're connecting that to the conversation as well, and any disorders that we talked about, mouth breathing and sleeping, sleep apnea, snoring, stuff like that, any speech or feeding concerns as well. But we're going to do that, and then I'll walk in the room, do my dental exam, and Addie will fill me in on what she knows. We'll connect the dots with the parents, make a plan, and we'll go from there.
Perfect. Yeah. No, this was a great overview on how this can really support people of all ages. But in our next episode, our last one together, we're going to be diving a little bit deeper into the airway health piece and getting a little bit nerdy in that, how orthodontics plays a piece in that, why mouth breathing really is so prevalent, how does dental work have to do with airway health, lots of questions on that. And so we have one more episode together, one more time that we get to try and pull all the knowledge out of your brain. And so you guys can get excited for that one. It's coming up next. If you enjoyed this episode, would you consider leaving a rating or review or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time, and thank you for being a part of the Motherhood Alliance family.